Considering we can't even keep track of our keys and wallet, it's not particularly surprising that we've struggled to understand how this invisible menace, like the coronavirus, spreads across the population. However, a new study was published recently that might shed some light on it. So grab your coffee and let's get started. Researchers used anonymized smartphone data to track movements of 98 million people in 10 major US metros from March to May, which is considered the first wave of the virus. They superimposed this data on top of COVID-19 case numbers to create a model that simulated coronavirus infections. And there were two major takeaways. Number one, and this comes as no surprise, but indoor spaces are the most risky. Crowded indoor venues such as restaurants, gyms, and cafes accounted for the majority of the transmission. And of those, restaurants being 4 times more dangerous as gyms and coffee shops. But more importantly, the second takeaway was the class divide. According to the research, people who live in lower income areas were also more likely to be infected with the virus. The average grocery store in low income neighborhoods had 59% more hourly visitors per square feet than locations in more affluent areas. Not only were the indoor venues more crowded, but low-income workers are also far less likely to be able to work from home. The pandemic is not an equal opportunity unemployer. The hedge fund manager escapes to the Hamptons while the line cook loses their job because restaurants are empty. That image reflects a consistent pattern in COVID-19's impact on the labor market. Lockdown restrictions disproportionately affect low-wage workers in the US. 39% of people employed in households making less than $40,000 a year were furloughed or lost their job in March, compared to only 13% in households making more than $100,000 a year. Before the pandemic, an increasing number of American workers were in the business of feeding, pampering, and caring for other Americans, especially the wealthy ones. And it's those same jobs, your Uber drivers, cleaners, hotel workers, that were most harmed by social distancing and lockdown restrictions. When higher income people stop traveling, going to offices, or eating out, it creates a disastrous ripple effect for workers employed in those services. And there are a lot of people doing this kind of work. 9.2% of all US employment was in food preparation and serving occupations, and another 8.5% work in transportation. Compounding the issue is telework. It is well documented that higher paying knowledge workers are able to transition to work from home far more easily than lower paying service employees, meaning it's easier to preserve those knowledge economy jobs. And it's not like eliminating low-paying, vulnerable jobs might theoretically be a positive development because it could push people into more stable employment situations, because that's simply not practical. Less demand for low-paying jobs does not mean a rise in demand for better-paying jobs. There are also high costs associated with losing your job, getting an education or training or experience required to enter those other fields. So on one hand, if people start moving around again, lower wage workers could return to their jobs. But on the other hand, reopening indoor businesses at full capacity is a recipe for super spreading. Researchers argue that limiting capacity at indoor venues can meaningfully contain the spread of the virus, especially when paired with critical precautions like social distancing and wearing masks. But with the recent surge in cases, which are well above 100,000 a day, it begs the question, should we go into another mandatory lockdown? Leave your thoughts on this issue in the comments below. Thank you so much for watching. My name is Arif, and this is Morning Coffee.